Hello, I'm Dr. Atkin, chiropractor and master herbalist, and today we're going to talk a little bit about headaches. Now, there's two general types of headaches. There's primary headaches where the headache is the main issue. In tension headaches and migraines, that's the case, and that's mostly what we're going to be talking about today. However, there's also secondary headaches, and that just means that the headache isn't the main problem. It's actually a side effect of something bigger going on. Maybe it's a side effect of a medication. Maybe you've got high blood pressure, diabetes, or something more serious. Maybe there's head trauma. Sometimes even constipation or dehydration can cause headaches. And so the headaches may be caused by something else. And as you come into the office, we can help you figure out maybe what some of those other causes are. But the vast majority of people have tension headaches and migraines. So let's talk a little bit about it. With a tension headache, a lot of times you'll often feel some pain and tension in other parts of your neck and shoulders as well. Sometimes you feel that pain right at the very base of your skull. It turns into a headache. Maybe you've got a lot of shoulder tension after a long, stressful day, and it becomes a headache. That headache's often felt in the back of your head. Sometimes it can only be on one side. Sometimes we even get it in the front. So a tension headache can be felt in different parts. In fact, a lot of times it's even a little band kind of right around your head, right like that. But tension headaches are primarily caused by something known as a subluxation. So let's talk a little bit about what that is. And to do that, we're going to need to understand about the nervous system. So this is a side view of the nervous system. The brain's sitting right up here. Now, the way that the brain works is that it sends healing messages down the spinal cord and out through the nerves to every single part of the body. In fact, nerves are coming from the brain stem out through your neck, and some of them are going back up into your head. Some of them are feeding the muscles in your neck and in your shoulders. They go to the thyroid gland, the sinuses, the ears, the eyes. They go everywhere. Well, what happens is that if that spine shifts out of position, it can put pressure on those nerves and affect that communication between the brain and the rest of the body. So if the brain's not communicating properly through that nervous system, then it can cause a lot of muscle tension and pain and headaches. That's kind of what causes the tension headaches. So the way that we take care of that is by gently realigning the spine and removing the nerve interference and removing the subluxation. People are able to function better, headaches go away, and it actually expands our body's ability to adapt to stress, because ultimately that's what causes a subluxation. There's physical, emotional, and nutritional stresses. So headaches can come after we're slumped over at our desk all day long. They can come after an emotionally stressful day. I mean, you guys have felt how emotions can cause everything to tighten up and lead to headaches. Well, as we adjust you, as you get that spine realigned, it'll be amazing to see how much better your body can adapt, and you can go through a day without getting headaches. So tension headaches, chiropractic is so popular for people with tension headaches because of how much relief that it brings. Now, let's talk about the other kind of headaches, migraines. Migraines are different. They're not like tension headaches. Migraines often come with some sort of a visual aura. You may see some nausea and vomiting. When you get a bad migraine, all you want to do is curl up in a ball, on the bed, shut off all the lights, close the windows, and just try to survive until the migraine goes away. And there's several different causes of migraines. Certainly one cause can also be subluxation in the upper cervical spine, and I've seen tremendous results in migraines if that is indeed the case. A couple other places that we've got to check though, right above the atlas is a bone in your head called the sphenoid. The sphenoid is what your brain sits on. And I have seen some incredible changes, some incredible improvements when we've adjusted the sphenoid. In fact, I've had people who have migraine for years and years, multiple times a week. They've come in, we adjust their sphenoid, and the migraines have gone away completely. Is that the cause of every migraine? No, I don't think so. I think there's a lot of causes, but as we check the upper cervical spine and as we check the sphenoid, as well as any other parts in the nervous system that might be effective, I've seen some incredible results and improvement from migraines. And I know those who suffer from migraines, even the littlest bit of relief goes a really long way. So if you haven't had your sphenoid checked, if you haven't had your atlas checked, this is the place to get it checked. We also do digital range of motion, a posture analysis. So if you've never had that process done, you've got to get it done. We always have some special deals going on. So find us on our website and come in and get checked. Let's get you relief from some of these headaches, and I look forward to seeing you soon.